Ever wondered about the key concepts, uses, and side effects of fluoxetine, commonly known as Prozac? Well, you've come to the right place. Fluoxetine, or Prozac as it's widely recognized, is an antidepressant that falls under the comprehensive family of drugs known as selective serotonin reuptake inhibitors, or SSRIs for short. This classification might sound a bit complex, but don't worry, we'll explain it in a way that's easy to understand. Fluoxetine's claim to fame is its widespread use in the medical field. It's one of the most commonly prescribed medications for a variety of mental health conditions, making it a staple in the world of psychiatric medicine. Its popularity is a testament to its effectiveness, but like all medications, it also comes with its own set of considerations. Now, let's dive into the journey of Prozac, from its discovery to its current uses. The birth of Prozac, as we know it, begins in the mid-1970s. This was a time when the understanding of mental health was rapidly evolving, and the need for effective treatments was becoming increasingly evident. In the midst of this, a pharmaceutical company named Eli Lilly and Company stepped into the spotlight. Eli Lilly and Company, a reputable name in the pharmaceutical industry, was instrumental in the discovery of fluoxetine, the generic name for what we now commonly refer to as Prozac. The company's scientists were initially interested in developing a drug to treat high blood pressure. However, during the research process, they stumbled upon a compound with a different yet potentially far more significant application. This compound was fluoxetine. The development of fluoxetine was a painstaking process, marked by rigorous research, testing, and a commitment to scientific integrity. The drug was designed to selectively inhibit the reuptake of serotonin in the brain, a mechanism believed to alleviate the symptoms of depression. This made fluoxetine the first of a new class of drugs, now known as selective serotonin reuptake inhibitors, or SSRIs. After a decade of careful development and testing, fluoxetine was ready to be presented to the Food and Drug Administration, or FDA, for approval. In 1987, the FDA gave fluoxetine the green light, marking it as safe and effective for the treatment of depression. This was a landmark moment in the history of psychiatric medication. It signified not only the birth of a new drug, but also the birth of a new approach to treating mental health conditions. With its approval, Prozac began its course to become one of the most prescribed antidepressants. It was not just a pill, but a beacon of hope for countless individuals struggling with depression. And that, dear listeners, is the story of how Prozac came to be, a testament to the power of scientific discovery and the relentless pursuit of better mental health treatments. From its inception, fluoxetine found its place in treating a variety of mental health conditions. Let's dive into these conditions and understand how fluoxetine comes into play. This medication is primarily used as a go-to remedy for depression, a mental health disorder that affects an individual's mood, causing a persistent feeling of sadness and loss of interest. By increasing serotonin levels in the brain, fluoxetine helps restore balance, improving mood, sleep, appetite, and energy level. Next, we have panic disorders. These are characterized by sudden periods of intense fear that may include palpitations, sweating, or feelings of impending doom. Fluoxetine helps by reducing the number and severity of panic attacks, ultimately decreasing the fear of having them. Then there's obsessive-compulsive disorder, or OCD, a condition marked by unwanted thoughts or sensations that drive an individual to do something repetitively. Fluoxetine acts on the serotonin system to help break this cycle, allowing individuals to regain control over their thoughts and actions. Bulimia nervosa, an eating disorder characterized by episodes of binge eating followed by compensatory behaviors, is another area where fluoxetine has proven beneficial. By reducing the urge to binge eat, it aids in the management of this condition. Last but not least, fluoxetine is used to treat premenstrual dysphoric disorder, or PMDD. This is a severe condition that includes physical and behavioral symptoms that occur in the week or two before a woman's monthly menstrual cycle. Fluoxetine can help alleviate these symptoms, making the period leading up to menstruation more manageable for those affected. So we see fluoxetine has diverse applications in managing mental health. Whether it's depression, anxiety disorders, OCD, bulimia nervosa, or PMDD, this medication has made a significant impact in the field of psychiatry. But remember, while this video provides a general overview, it's always best to consult with a healthcare professional for personalized advice. Stay tuned for our next scene where we discuss the duration of treatment and addiction potential of fluoxetine. One common question is, how long should one be on Prozac? The answer to this largely depends on the individual and the condition being treated. Generally, treatment with fluoxetine or Prozac is not a quick fix. It's a long-term commitment. For conditions like depression and anxiety, a minimum duration of 6 to 12 months is typically recommended after symptoms have improved. For obsessive-compulsive disorder and bulimia nervosa, treatment may need to be longer. The duration can be influenced by several factors. Your healthcare provider will consider the severity of your symptoms, your response to the medication, any side effects you're experiencing, and your overall health. They'll also take into account the risk of a relapse if the medication is stopped. It's important to remember that stopping treatment abruptly can lead to withdrawal symptoms, so it should always be done under the guidance of a healthcare provider. Now, let's address a concern that many people have. Is Prozac addictive? The answer is no. Fluoxetine is not a drug of abuse. It does not cause the euphoria that people who misuse drugs seek. However, it's worth noting that suddenly stopping the medication can result in withdrawal symptoms, which some people may mistake for addiction. These symptoms are actually a result of the body adjusting to the absence of the medication, not a craving for it. It's also important to remember that everyone's experience with Prozac is unique. Some people might experience side effects or withdrawal symptoms, while others may not. And while it's not addictive, it's not a medication to be taken lightly either. It's a powerful tool in managing mental health conditions, and like any tool, it should be used responsibly. In conclusion, the duration of treatment with Prozac varies and should be determined by a healthcare provider. It's not a drug of abuse, but it does need to be managed carefully to avoid withdrawal symptoms. Remember, following your healthcare provider's advice on the duration of treatment is crucial. Unlike all medications, Prozac has potential interactions and side effects. It's important to remember that while we're focusing on Prozac or fluoxetine, these principles apply to all medications. Let's start with the side effects. The common ones include nausea, upset stomach, diarrhea, dry mouth, sleep problems, and weight changes. It's important to remember that not everyone will experience these side effects, and if they do occur, they're usually mild and temporary. However, there are also serious side effects to be aware of. These include serotonin syndrome, which is a potentially life-threatening condition, and increased risk of suicidal thoughts and behaviors, especially in young adults. Uncommon but serious side effects can include unusual bleeding or bruising, persistent nausea or vomiting, and changes in sexual desire or ability. Now let's shift gears to drug interactions. Prozac can interact with many other medications. For example, other drugs that increase serotonin levels, such as St. John's wort or certain migraine medications, can increase the risk of serotonin syndrome. Similarly, blood thinners can increase the risk of bleeding when taken with Prozac. It's also important to note that Prozac can have interactions with over-the-counter medications and dietary supplements. For instance, aspirin and non-steroidal anti-inflammatory drugs, or NSAIDs, can increase the risk of bleeding when taken with Prozac. This is why it's crucial to inform your healthcare providers about all the medications you're taking, including over-the-counter drugs and dietary supplements. This will help them make the best decisions about your treatment and monitor for potential drug interactions. Remember, this information isn't meant to scare you, but to inform you. All medications have potential side effects and interactions. The key is to be aware of them and to communicate openly with your healthcare provider. Being aware of these interactions and side effects is key to safely using Prozac. In our journey today, we've covered a lot about Prozac. We began with an understanding of what fluoxetine really is, moving on to its fascinating discovery. We explored its varied uses, primarily in treating depression, obsessive-compulsive disorder, panic disorder, and bulimia nervosa. We also discussed the usual duration of treatment, emphasizing that it's not a habit-forming medication. However, we did not overlook the importance of being aware of potential drug interactions. We highlighted the need to inform healthcare providers about any other medicines being taken, including over-the-counter drugs and supplements. We also delved into the potential side effects, ranging from common ones like nausea and insomnia to more severe ones requiring immediate medical attention. So, whether you're a healthcare professional or someone keen on understanding more about mental health medications, knowing about fluoxetine is indeed beneficial. Until next time, keep learning and stay healthy.